Hello. Can you hear me, doctor?
Yes, I can hear
Oh,
you.
great. Hi, everyone. Good morning. I'm Soumya, and it's my pleasure to be the host for you today. Today, we are discussing about the topic navigating the fertility journey. Before we begin, I would like to ask you a question. How many of us have heard someone say, just relax, it'll happen, or you're still young, don't worry? These perhaps are the most common uh, these perhaps are most common things that you hear from people when they are trying to get pregnant. They are often well intentioned, but they leave people with more questions in their mind. The truth is, fertility is not just about age, timing, or luck. It is deeply personal, uncertainty at times, disappointment. Yet despite some most of the common fertility challenges are they continue to surround with myths, misinformation, and uncertain sigmas. This is exactly why we are here today. Over the next hour, we will address all the concerns that you have in your mind, the most important and frequently asked questions around fertility, from understanding when it's time to seek help, who to go, when should you go, and how do you know when to go. So today to discuss about the topic, we have Dr. Pallavi Chalsani from Birthright Fertility by Rainbow Hospitals. Hi, doctor.
Hello, Soumya.
Hi.
Pleasure that we are here.
Yes. So, doctor, welcome to the podcast. So, first thing I would like to ask is, how would a couple or what basically, if you can just explain about entire IVF process, that what exactly is IVF?
The IVF process is the last stage of the treatments which we do in IVF clinic. So in case if somebody is coming for an IVF process, it's a 2-month process. The first month they have pre-medications wherein we put them on some antibiotics and antifungals so that we take care of this chronic endometritis, chronic pelvic inflammatory diseases, which we cannot see. There are not acute infections. So we take care of them. And exactly in the IVF cycle, what we do is we give them ovarian stimulation so that we try to retrieve all the eggs which they have for that cycle. And then it would be follicular study with hormonal tests so that we know that, okay, the follicles are going great with whatever dose we have started. And after doing a follicular study, when we know, okay, this is the exact follicular size and this is the exact hormones, when we get to have more matured eggs, that is the time we give a trigger injection. And after 36 hours of trigger injection, we do a retrieval that is called oocyte retrieval. It is done under short general anesthesia. Once we retrieve the oocytes, we also select the sperms to high-end techniques. Then we do a technique called ICSI. It is called intracytoplasmic sperm injection, wherein the sperm gets injected into the cytoplasm of the oocyte. That is called ICSI. This is called the fertilization, which we do it outside in a normal terms. So the fertilization is taken care with a process called ICSI. Then we incubate the babies on day 3 to day 5. Either on day 3 or day 5, depending on the growth of the embryo, we do some grading to know whether the quality of the embryo is good enough. Once we have a good quality embryo, then we counsel the patients depending on their hormones, depending on all the checks which we do, the protocol which we follow, whether to transfer in that cycle or whether to freeze the embryo and reuse them in the next cycle when they're perfectly all right, or whenever the couple wants to give it a try.
Sure, I think many of us were not aware of the entire process, but thank you for taking us through the entire thing. So, but doctor, the main question arises that when would one know that they should come to an IVF doctor? Because most of them usually go and visit their gynecologist. Most of them are in the consultation with the gynecologist from, say, a menstrual cycle. Since the girl begins with their menstrual cycles, they go and visit the gynecologist. But how would a couple know that it is the time to visit their IVF specialist?
Yes, see, the fertility centers are here to help you to make a ease of your pregnancy or parenthood. So when do you have to visit is very important. In case if a couple have tried for almost 1 year with unprotected sexual intercourse, who have a regular cycles, who do not have any health issues, let's say it's a healthy couple, and they've tried for 1 year, and the age should always be less than 35. For these couples, we can say after 1 year they can seek the fertility help. In case if the couple is above 35-year-old, 6 months, if they would have tried perfectly and they're not succeeding, that is the time when they have to reach. Or if the couple is beyond 40, or if they have known problems already, let's say there are irregular cycles, or their sleep pattern is not good, or they have some endometriosis which is already diagnosed, or they have multiple miscarriages, or they have severe infections which they kept on seeing a gynecologist, or they have taken a long time already with a gynecologist and still they have unsucceeded cycles. These are the couple where they have to reach us.
Right. And doctor, for a women specifically, you know, how, like, if the periods, if the menstrual cycles are normal, but can she still face fertility challenges?
See, it is not only the menstrual cycle which dictates fertility, or if the person's menstrual cycle is good, it just doesn't guarantee that there is no fertility problem. There are n number of problems. Okay, it can be both in both the couple. It is always a couple oriented. It is not an individual problem, first thing. So the couple has to be oriented that the periods are regular, that's great. See, that means she has her ovulation on the perfect time. That is really good sign. But the rest of the things also give their part in the fertility treatments, like the uterus. If they have any problems in the uterus, let's say adenomyosis, fibroids, or any abnormal shaped uterus, like the septums, or there are didelphys uterus, all these problems can also cause fertility issues. Tubal blocks can cause fertility issues. Male factor, wherein the sperm count is less, or if the count is good but still the motility and morphology is less, also can lead to a fertility factor. So it's not only the regular cycle.
Right. So when a woman wants to seek guidance from a fertility doctor, so what is there a particular sign that she should know, or she would know that yes, there is a issue that is happening, that I must consult a fertility doctor and not a gynecologist?
Yeah, the factors would be definitely first thing would be irregular cycles. The second factor, if she has immense pain while having menstrual cycle, see the pain threshold might be different for everybody. Some people would just not have any pain and they can just do their routine activity. But if the pain is so intense that her regular activities are getting hampered, that means there might be some pathology like adenomyosis or fibroid in her uterus, which she had to get a scan done to, actually know it. Or if they have tried enough for like 1 year, but still they're not conceiving, or they had multiple abortions which we call as miscarriages nowadays. So if they have these conditions, they have to seek a fertility specialist.
Right. And one of the most underrated question I would say is infertility only women's problem?
It is definitely not a women's problem. It should not individualize the problem like that. It is definitely a couple oriented thing. And yes, see, the even a small male factor or the smallest blood test which we perform or lifestyle modifications for men, if the women is completely normal, can change the whole scenario. The pregnancy can be much easier.
Right. And how would a man know? Like you have just explained so wonderfully that how can a woman seek help? How do a man seek help? Because there is a lot of, I mean, resistance when it comes to talking about fertility in men. So how would a man come to a fertility clinic and seek help?
Here we see it as a couple. We do
Right.
not see it as a male or a female factor. It is always good that everybody knows that the pregnancy happens together. It is not an individual factor. So it is always, if there is, I mean, you need not have this resistance within you. If you have any problem, then it is very easy to meet your fertility consultant, and then the fertility consultant might run through you some tests, like the blood test, routine blood test. It might be just hemoglobin, thyroid, and prolactin and things like that, to see his general health. We would take the detailed history about his habits, his sleep patterns, about his stress levels. In case if everything falls in place, then we would run him through a semen analysis test, which is a basic test. In case if everything is also normal in semen analysis, then we assure him, okay, everything is going right with you. In case if there is a deviation, probably we will put him to a andrologist, who is a male fertility specialist, so that he can go through more lot of tests and more examination protocols.
Right. So, doctor, you have explained what IVF is. You have explained how a normal menstrual cycle is not the only cause, or can mitigate the cause of fertility. You have explained women's infertility. You have explained men who can also have infertility issues. So, but doctor, in case if the couples are feeling absolutely healthy, they are very healthy, their lifestyles are healthy, do you say that still there can be issues when it comes to conceiving normally?
Yes, there might be issues. See, it is all about age. Even if the healthiest couple in a normal age, what I mean is below 35, are not able to conceive for 1 year of try, then definitely they have to seek a fertility consultant. There might be other issue, as I already mentioned, like the periods might be regular and they might look normal, they might look healthy, they might look okay with everything. But still, if they are struggling, there might be hidden factors like, the tubal factor or the male factor. Until unless the semen analysis report is done, you will not know what's happening with the semen test.
Right. So, my next question is, you just said that age matters. So, right now, when you see that how it used to be before, maybe a decade back, is people used to get married in their late 20s or early 20s.
I should say
Right now,
early 20s.
everything is now pushed to 30s.
Correct.
So when it is being pushed for different reasons, so how is that entire cycle taking place? How are you seeing that, there are more issues right now? There are lifestyle changes that people have adopted to. There's a lot of stress. There is poor sleep that people are facing. So how are these affecting the entire fertility process?
See, as you already told correctly, the life cycle has changed. There are more career oriented people now, career oriented women. That's really nice. That means we are advancing. But still, it has to run in parallel paths. It cannot run in a single path. So it always has to be a rail track where you have your career and also have your family together. I always suggest that 18 to 30 is the golden period for conception, wherein you have beautiful, healthy babies, the conception is not a problem, and things like that. As you age more than 30, especially for women, the egg quality almost drops by 25%. After 35, it drops by almost 50%. After 40, it almost drops by 90%. See, that's how the rhythm is. I mean, you have to go with the rhythm. The rhythm is that you have to conceive between 18 to 30, and then 30 to 35 or 40, you'll raise your child. And after 40, it would be definitely a transition to menopause. That's a routine lifestyle of any women. But just because of this career problems or because of the society pressure, or yeah, obviously it is an individual's decision to get married or have a child or whatever it is, the age is getting shifted when compared to the previous decades. That is definitely there, and it also impacts men. The production of sperm is definitely there for lifetime, but the count might be normal in men who are, let's say, above 40, but the quality, the DNA, all this start changing after 40. So there are a lot of fragmentations in DNA. The quality comes down.
Right. And, everybody feels that if they are coming to a fertility doctor or a specialist, IVF is the only solution.
That's right. Yeah, I just wanted to break this. Yeah. Fertility doctors are here to help you to get pregnant, not to do an IVF. That is very clear statement from Birthright Rainbow. So here what we do is we start the couple to take the history so that we know what is a detailed history about them, and we individualize it. The treatment is also personalized and individualized and tailored. It is not a dictum that whenever people come to a fertility specialist, it's only IVF. IVF is the last stage. When we are done with everything, all the normal things, like let's say we would just try a natural cycle also for some couple. We have a lot of pregnancies wherein the couple just come and we just see a normal basic cycle. We don't even give them ovulation induction, wherein we don't even give them any drug. We just tell them lifestyle modifications. We just run them through a normal blood test like CBP, which is the blood sugars, her hypertensions and thyroids. If we start correcting minimal things, we have a lot of pregnancies. 30% of them get conceived in that category. Only when we fail there, we take them to the next level. That is, just put them on some drugs to help them to ovulate. These drugs might be just ovulation induction drugs, which everybody takes. That is a very basic treatment which we do. In this treatment, another 20% conceive. So almost we are done with 40%. So the rest 40% might not be, compatible to these treatments. So we take them to the next level treatments. Those might be IUI or IVF. So once we fail all these treatments, we take them to IVF. Generally, straightforward IVF is said only for certain category of people, not for everybody.
Right. I think that is something that everybody should understand. But doctor, one thing is, like once people have also this thing in their head that once we go for IVF treatment, the next also has to be through IVF and they can't conceive naturally. Is that true or is that a myth?
It is definitely a myth. We have n number of patients who have conceived their second kid naturally after having their first kid through IVF. If you ask me why was the first kid through IVF and why not naturally, see, the mind state would be definitely different when they have to have their first kid and they're already 30 plus, and the stress factor is too much. And we would have definitely tried, if everything would go well, we would have tried them with ovulation induction, IUIs. If all this were not working, we would have gone for an IVF and given them a baby. But once they have a baby, that stress or pressure on the couple is definitely come to zero. So that stress factor, whenever it comes to zero, probably that is when they have natural kids in the second shot. But all said and done, in some situations, like let's say the age is above 40, the tubes are blocked, they have severe male factor, these are the cases which I would say, yeah, they might have required a second IVF for a second baby. Not for everybody.
Right. And I mean, that is, I think, something that, people need to understand also that this is just a process for people. Like, you're just helping. IVF is just to help them to get pregnant. But a lot of people also feel that if they get a baby from, with the help of IVF, the babies won't be healthy. They will be very different from how a naturally conceived baby would be. So, what would you say on that?
This is a regular question. See, in Rainbow, what we do is whenever we take a couple to IVF, we make sure that we sit down with them, give them a 1 hour time. We make sure we explain the whole IVF process, how it goes, how are you going through, why am I saying only this much percentage in your case, why am I even doing an IVF in your case. All that would be explained to a patient or the couple. And the first question I get from them is this: would the baby be normal or whether it is abnormal? See, when somebody sits at home and then they conceive naturally, there's always 5% chances that they have an abnormal baby, or uh, or they might have a miscarriage. That is also a 5%. Even in IVF, it is the same 5%, where they can have a genetically abnormal baby and they can have a 5% miscarriage rate. That is not because of the IVF procedure as such, but it might be because of the genetics running in them. Or it might be the personal care which they generally take in the pregnancy time. Or the environment around them is what is going to change, but not the procedure.
Right. You spoke about genetics in them. So a lot of people come and ask, there is this thing that, I would rather go to a gynecologist and seek help, but if I go to an IVF doctor, people might have something else to say about it. So and they, because of that entire gap in their head, they come very late. So what would you say about that, that after coming to you for a consultation, maybe after 1 2 3 years, rather than coming and asking you, seeking help for it, what is your say on the entire take on that? How have you seen couples coming to you, and how have you advised them that if you would have come early, it would have been better? We could have eradicated the entire thing of IVF and given you some medications, and you could have conceived.
Yeah, see, for a woman, the first option definitely is a gynecologist, because gynecologists deal with irregular cycles. They deal with the pregnancies, and they're more the social stigma to going to a gynecologist is definitely a big zero. But coming to a fertility specialist, yeah, it's just like one step ahead you have to think. I would definitely not say don't go to a gynecologist for help. Please go to them. But once you know that your egg count is less, when you're running out of time, when the sperm count or quality is less, or if they say that your tubes are blocked, or if they say that, okay, I have done enough, like 2 3 cycles I've already tried and it's not happening, probably that is a place where the gynecologist also should tell them, okay, now it's the time to seek fertility specialist help, or the patient also have to realize that, okay, this is where you have to go to the fertility specialist.
Right. And doctor, we'll just take 2 steps back, that where we are talking about the lifestyle that has changed the thing entirely now. So do you think, and or would you say that lifestyle changes, if a person brings the entire changes, like they get back to how they were before, will help them improve their fertility?
I would say a big yes for this, but I would not say that the plate will turn around. It's not like that. So yeah, if you do a lifestyle modification, if somebody has a substance abuse, let's say somebody is taking smoking or alcohol, if they come cut down to zero, probably from there the life gets better. The things might not go worse in case, like, let's say the sperm parameters, but the damage what is already happened might not revert back. So it's always a big no for substance abuse for the first time itself. In case if they want to quit, that's a good thing. You will at least get better, but it is not complete reversal.
Right. And if you have to suggest few of the main needed lifestyle changes in the couples who want to conceive naturally, what are those changes that you would suggest?
Yeah, first thing is absolute no for junk food, no pizza, no burger, and yeah, no aerated drinks, no substance abuse, and do self care. That is really, really important. Leave about fertility, but you are more important and more precious than having a baby. First, when you are good, you feel good to have a baby. So that is really important. So lifestyle modifications, as everybody knows, it's just diet and exercise, the two words, two magic words, but then it's really important how you do a diet, how you do your exercise. It should be high protein, low carbs, high, in fiber rich foods, and a lot of, micronutrients. And exercise, definitely it is a game changer in cases like PCOS and obesity patients where they're struggling for, having a kid. At least weekly, 5 days should be your target. Every day, 40 minutes, you should at least do some cardio.
Right. So, doctor, I think that helps a lot of people. But also, I mean, if you had explained in a gist on IVF is not the only resort that people can go to. So, can you help us understand more about what is IUI? What are the even before treatments that people come to you, and how, when people have come walked into your clinic with a problem, but they have conceived naturally? So, if you can just shed some light on that as well.
Yes, sure. See, there might be minimal problems. See, I divide the whole treatment into 5 categories. So the first category of patients would be completely healthy couple with the bloods being absolutely normal, with the cycles being regular, the semen parameters being regular, the tubes being open, and no other pathology. In such cases, they can just try naturally by doing a follicular monitoring. All said and done, the age should be below 30. In these couples, if we just do follicular monitoring, if we just say that, okay, this is the window where you have to have contact and the success rate increases, this is a time where the ovulation is occurring because we monitor it through a ultrasound machine, we are more precise doing so. So if we can do a time relation, that's called time relation. It's a natural cycle plus time relation. So as I said, already 20 to 30% people conceive in that platform. In case they don't conceive, and if they have other factors, let's say they're coming into a factors called they do not ovulate. These non-ovulatory people are PCOS people, maximum of them. So in these cases, we just do an ovulation induction plus time relation. This is a second category, wherein we give some drugs to ovulation, we monitor it under ultrasound, ask them to have contact whenever the time comes, whenever it's getting ovulated. And the third category would be IUI. In these patients, whom do I select for IUI is in case we have tried enough in a healthy couple who do not have any problems. We've tried enough of natural and OI cycles, but still they're not conceiving. There, the IUI plays a role. Or if there is mild male factor, not severe, mild male factor, or if there is some cervical pathology. We always say that the cervix of the women can have something called anti-sperm antibodies, wherein whenever the sperms get deposited in women's vagina, the sperms have to swim up through the uterine opening into the tube. When it has to swim up, a lot of sperms get killed there because of this anti-sperm antibodies. So in IUI, what we do is we take the whole sperm into a catheter wherein we go high up and we just bypass this wherever the anti-sperm antibodies are trying to kill the sperms, and we release it inside the uterus very close to the tube. So that is the advantage in these people to make a pregnancy. So IUI is recommended whenever there is some problem with the male, that is a mild problem, or when it is unexplained, it comes into unexplained category, or when there is a cervical factor, or the women has less time, let's say because of the age or something like that, we rush doing an IUI cycle. But all said and done, there is a mandatory dictum for IUI that there should be at least one tube should be open.
Right. I think that explains everything very well. But one more question is that does every fertility problem require a treatment, or is there something which can, with a medication or with a lifestyle change, it can get better?
Yes, of course. See, there are a lot of things which can get better, but it might take some time. Like in PCOS, who is obese, who has more of, thyroid is high, and then the patient is pre-diabetic, just in the zone of getting diabetes. In these patients, lifestyle, diet would definitely convert the things back.
Right. And, I mean, when a couple comes to you for the treatment, what are your suggestions to them for, supporting each other? Because both of them, I mean, mentally, they're also stressed. They're also they're not very sure of how the people will talk about them when they say that they are taking an IVF treatment. So, what kind of support or suggestions do you suggest usually to those couples?
See, the whole fertility journey is within the couple. It is more intrinsic and it is more personal. I would just say, except the couple, the rest of them, let it be friends or let it be their mother, father, whatever it is, it's the next layer. I would not say don't seek help. If they are okay to seek help from the third person, I'm okay with it. But it should be a healthy support. It should be a healthy support from parents, friends. Yes, seeking a shoulder is not at all a bad thing. But definitely, you should know, or the couple should be very confident that, okay, she is definitely going to be there for me throughout my journey. That should be your shoulder where you rest, not for anybody. I mean, you just can't keep on telling to anybody. And whatever the couple has to undergo, it is definitely an intrinsic thing wherein no blame game. That is what I just tell the couple. There is no blame game. It is as a couple, you have to make a pregnancy. So you have to support each other whenever you're traveling. And I always request them, if you have time, please come as a couple to the clinic instead of, only one person walking in. There is a lot of support when you come as a couple.
Right. And what do you suggest to them to avoid feeling very overwhelmed? Because this entire process is very overwhelming for anybody for that sake. So what are your suggestions to them?
See, it's all said and done, it's only temporary. It is not a permanent, course which they have to undergo. Someday they have to get pregnancy, and yeah, we would make sure that we would help in that. So it's when it is a temporary process, you look it as a temporary process where there is an end. Do not look as if there is no end. That is why I always tell them, don't waste your life now. Because see, once you have a baby and once you think back that you have wasted so many days, getting depressed or feeling sorrow that you didn't get pregnant and shedding tears, which is completely a waste of thing. Once you, it'll be a past one day.
Right. And doctor, also if you have to tell the couples on some changes that they have to bring in their life before they start planning for an IVF treatment, or even before they plan for any fertility treatment for that sake. So what are those changes like before you start with the treatment?
See, anybody before you start with the treatment or before even you get married, your lifestyle, you should set it right. The lifestyle is what is going to take you through not only the pregnancy but your whole life. That is what is going to support. Nobody else is going to come and support you. It is your health which is going to be with you forever. So taking care of yourself, giving some time. I know you're running in a race. There is no option. All of us have to run. But make sure you make some time for yourself. Pamper yourself. Eat what you like. Eat healthy. Do some exercise. Keep yourself fit and laugh with your friends. That's very important. I mean, let things out. Don't keep stress inside. If you have some problem, speak it out, solve it out. Let it be whether it's in the family, with the husband, or at the workplace, whatever it is. And get some nice sound sleep. That is really, really important. Sleep is a boon for humans. It is a healing process. If you don't sleep in a proper time on a proper hourly basis, then it's difficult. Your body will not heal. You can't do that to your body.
Right. And in the similar line of question, one more thing is that what do you usually suggest, or what should a couple know before they start their fertility journey? What is happening with them? Like, what can they expect? What can they not expect?
If they're very curious that they want to know, like we have a lot of couples walking in saying that, okay, we're getting married next month. What are we supposed to know about each other? Or what are the tests which we have to undergo? See, the advancements are so much that people also ask us preconceptional counseling. So what we ask them is a detailed history, whether the women has regular cycles, how is her diet, how is her sleep, what is her stress level, and we take some time to understand how her daily routine is. So we make sure, okay, everything is normal. Then we do not run them through unnecessary tests. But if we think that okay, something is going beyond normal, then probably depending on that, we tailor whatever tests are required for her and we do the test. Until unless somebody says, okay, I want all the hormone tests or I want some ultrasounds to be done on me, I want a semen analysis to be done, we do not really recommend until unless the age factor is there. All said and done. If they are below 30, we give them reassurance. We tell them, okay, you're fine. And like, clinical examination history gives almost 80% of the things which we have to know. The rest 20% would be your tests or, running them through an ultrasound or, semen analysis would give more information.
Right. I think we have answered a lot of questions, right? And we have got a clarity on a lot of things today, Doctor. People who are watching us today on this webinar, please post your questions in the Q&A box so that the doctor would be there to answer all your questions and queries. Is there anything else that you would want to talk about the entire IVF thing? Because I mean, there's a lot said and done, but still there is a myth. There are misconceptions. There still the taboo exists. So, how would you like to talk about the entire process?
Okay, see, I wanted to talk more about the irregular cycles
Right.
because the irregular cycle is what is saying that something is going really wrong with your system. That's a first sign. Okay, when you have a irregular cycles, prior we had a lot of PCOS, which is called polycystic ovaries,
Correct.
and people always think irregular cycles. is only because of PCOS. But PCOS is what, see, generally what a woman has to have is 8 to 10 eggs on each side, which is a total count of 20. If they have more eggs, let's say more than 12 on each side, it is called PCOS. So I'm still fine with the normal people who has normal egg count, still fine with PCOS people. But there is always the opposite end of it, which also represents like a irregular cycle. That is POR, which is called premature ovarian aging, or the ovary is aging faster than their age. Let's say women is somewhere around 30, but her ovary age is somewhere around 40, like how you have a gray hair at 30. Say any organ in the body can age faster. The same thing can happen with your ovary too. But the problem is when it happens with the ovary, the egg count comes down. If the egg count comes down, the probability of getting pregnancy would be a big question mark. So whenever you have a irregular cycles, make sure you meet your proper fertility specialist to understand whether it is PCOS or whether it is because of thyroid that you're having irregular cycle, or whether it is the opposite end of PCOS, which has become rampant nowadays. I don't know, because of the adulterated food or the stress factor or whatever is happening all in this era. It is like we are in a very different era where we cannot complain nor we cannot regret. So yeah, because of the technology or because of the radiation. So make sure in what category you are, so that at least, see, if in case you are in a normal category and it is just because of thyroid correction would be enough. If you are in the PCOS category, I would say lifestyle modifications and diet. But if somebody is in POR category, which is premature ovarian insufficiency or aging, I would always recommend them to think about their future, whether they want to freeze their eggs, whether they want to get married soon, whether they want to finish baby faster. So that kind of protocol we can still follow on these people, and we can at least educate them so that they know that and they do not have a shock later.
Right. You have touched upon the topic egg freezing, which is also a very talked about thing when it comes to celebrities or anybody for that say. A lot of people are opting for egg freezing. So can you just give a brief explanation on what it is, who should opt for it, how can one do it, and is it right to do it or not?
See, egg freezing, you should not take it as a something very abnormal thing which is happening nowadays. It is, I would not say it is a celebrity thing. I think everybody should put their foot down. All the girls who are career oriented and who are, wanted to postpone their pregnancy for some reason, please make sure that you have seen how many eggs you have or the reserve you have. The egg reserve can be checked by two ways. One is on day 2 or day 3, we do an ultrasound to see how many eggs the woman has. That is a follicle count, which we do, which is called antral follicle count. And the second thing is we also run them through some of the hormones, which are called AMH, FSH. So these hormones will tell us what is the egg reserve which they have or left with. If in case something is going wrong, let's say the count is less on the ultrasound or the AMH levels are less or the FSH is high, these are the patients or these are the women which we obviously tell them, okay, now please sit down and understand that there is a problem with you, and it is not going to be the same if you want to get married after 10 years and want to have a natural pregnancy. It might happen, but we can't take a chance. So I would always recommend them, okay, please come back to the ground reality, and if you want to freeze your egg, you do, please do it. It is just a bank, like how you save your money, and you can use it if you want. If you don't want, yeah, let them go. That's it. It is just a bank. It is not some myth or it is not some hi-fi thing which people always think, okay, egg freezing is something wrong or it's something hi-fi which only celebrities have to do. No, it is not. It is going to save your future. You're going to have your kid on your own with your own gametes. That's really, really important.
Right. And what is the right age to opt for egg freezing?
It is not the age, it is a situation where it says whether it is right or wrong doing a egg freezing. Let's say somebody who is 20-year-old have some cancer, and then we have to go ahead with chemotherapy for that patient. And then this is the patient, obviously the chemotherapy or radiotherapy effect will impact on the ovary and decrease their egg count. So these are the patients whom there is no age. So in these patients, let's say even if she's in 20 and then if she has to undergo chemotherapy, we would always advise that, okay, you please go through your egg freezing protocol.
Right. So I think this explains a lot, and we are getting a lot of queries, Q&As on the topic. But most of the queries are on PCOS, PMOS. So people are want to understand that when would one know that they are going through the PMOS? There are symptoms of PMOS in them. So if you can explain a little more about PMOS to all our audiences.
Yeah, PCOS has been converted into a word called PMOS recently. So it's almost the same. The background is the same. So when will you know that you have a PCOS is sometimes you will not at all know. It is absolutely asymptomatic, or sometimes your periods might be irregular. It might be shorter or it might be longer periods. It can be both way, and sometimes the flow. Generally, what we say is 2 to 3 days at least people have to bleed. If the flow is less, then the probability of having PCOS might be more. And if the somebody is putting on weight, they have thyroid, sudden hit of thyroid, sudden hit of diabetes. These are the, or somebody is losing hair drastically and having hair on abnormal places, like let's say on the chest or on the cheeks, or let's say the upper lip is growing too much, or if they start having a darker line on their back of the neck, which becomes, evidently dark. People think it is because of the chain reaction which they're wearing or the ornaments which they're wearing. It is not true. All these are the signs of, getting a PCOS.
Right. And there's one more question from the audience who has asked that even with PCOS, can they conceive naturally? And what are the best supplements for PCOS?
I would say, see, PCOS is in case if there is PCOS and there are other added problems like thyroid, obesity, and irregular cycles. Probably these people might require a little help, very little. Let's say if you put them, the problem in them is ovulation. They do not ovulate on time. That is the whole problem with these people. So when we give some drugs for ovulation, they will ovulate, and still it is supposed to be a natural conception only, because we do the ovulation induction in them. But yes, if in case it is, the obesity is too much, and then the PCOS also is too much, like let's say bilateral, they have more than 30 follicles. Instead of more than 12, we consider as PCOS. If it grows to more than 30 and they have other symptoms which is set in, like diabetes, obesity, and things like that. And it depends on the duration also. Let's say they had irregular cycles since last 10 years or 15 years. Only if they take a pill, they bleed, something like that. In these patients, they might require more help, little more help. But all said and done, PCOS is supposed to be, I would not say it is a big disease. 99%, if they get properly treated, would get a positive result.
And is PCOS reversible?
It is not reversible. Yeah. But definitely you can try to reverse it. It is not, I would not say it is difficult, but I would not promise that things can revert back. But yeah, if you have a constant try, because it's all in lifestyle modifications and little support from the medications and diet is what PCOS gets reverted to.
Right. For the audience who are watching us today, I request to post all your questions in the Q&A drop box. We will answer as many questions as possible in the time. So we have another question, doctor, that hi, I have done IUI cycle positive, but it is failed pregnancy later, and please help me with this. I have PCOD and thyroid issues.
Yeah, see, the pregnancies might fail because of multiple reasons. It might be because of bad quality egg, or formation of a bad quality embryo, or because of the sperm also. Not only the embryo side, but it might be because of the implantation side, which where the endometrium is really important and it plays a key factor. So it's like, just for a normal understanding, we have a soil and we have a seed. Seed is the embryo and the soil is the endometrium. Both of them should go in synchrony, and both of them should be like too good to handle each other. That is where you get a good pregnancy. And other than this, the genetics also play a role. It is not because of the procedure, but probably there might be some genetical abnormal chromosome which the pregnancy have dropped off. And all said and done, if somebody has an abortion because of treatments or non-treatments, it doesn't mean that they will have an abortion in later phase, but they might have wonderful babies. 95% they will have a normal baby. It's again only 5% where the abortion repeats.
Right. So, the next question from the audience is it necessary to take genetic tests after two miscarriages? And what type of genetic tests do you recommend?
See, there are a lot of things which play for recurrent miscarriages. That's a term which we use. When it is more than two, we say the patient has recurrent miscarriage. So when we start off with recurrent miscarriage patient, we not only start with the genetics, we start with the normal things. Like let's say your hemoglobin, thyroid, prolactin levels, blood groups of both the partners, whether both of them are positive blood group or one of them is negative, mother is negative blood group. These are with the bloods. And the second step would be whether the uterus is normal, whether it has any extra growth inside the cavity. Those also can cause abortions, like just a polyp or any adenomyosis, fibroid. Probably if we remove them, the pregnancies might turn out to be better ones. So once we are done with the bloods, once you have seen ultrasound, once you have seen, okay, the uterus is completely normal and there is no abnormality in that, the next level would be definitely to check the age factor. If the age is too much, then we do a basic test, which is in genetics, which is called karyotyping. That is, as you know, the female should be 46XX, the male should be 46XY. But if there are some other balanced translocations or there's some abnormal chromosome in them, probably that might be one of the reason. All said and done, if all of them is normal, then we would think next about the egg quality. Whether are we probably on the scan, on the ultrasound, everything would look normal. But when we go in depth in this such cases, when we do an IVF and when we pick the egg out, we put them under microscope. When we magnify things and see, we might pick a lot of abnormal oocytes, wherein the number is definitely good, the age is definitely good, but probably there is an abnormality in the egg, or the egg is completely normal, there might be a problem in the sperm. Or all said and done, everything being normal, even if the baby is formed, let's say we've proven that this baby is already formed and till day 5 everything went well according to the protocol, but still somebody is having a miscarriage, that last step would be the endometrium, wherein whether there is any other problem in the endometrium, like say like pelvic inflammations or infections, chronic infections in the pelvis or the endometrium. Like in India, TB is more prone, which people think it's only in the lung, but TB can be everywhere. It can be in the spine, brain, abdomen, and genitals also. When I come to genitals, it might be in the male genitals, it might also be in the endometrium. So, all these factors play a major role in recurrent pregnancy loss. It is not only the genetics, but it is as a package which we have to look.
Right. The next question that we have is I have done multiple IUIs and two IVF transfer but it was a failure. Reports are normal, but I have mild adenomyosis in uterus.
Adenomyosis.
Yes. What should we do? Please help.
See, for mild adenomyosis, it depends on, I don't know how is the term mild, moderate given, but once we look into the patient and then the adenomyosis is little far away from the cavity and it is not going to hamper the cavity, or if it's, manageable with drugs, then what we do is in such cases, we try to do an IVF in such cases. We try to freeze the baby. Then once we froze the baby, we try to get down on the adenomyosis, because I am against surgeries in adenomyosis case until unless it is very severe adenomyosis and the uterus is like overgrown in size and shape and it's like outgrown. Only then we opt for surgeries. Otherwise, we can just give them some injections where the adenomyosis come down. And when we have beautiful embryos and when we have decreased the adenomyosis with some drugs or there is a radiotherapy also, once we do this and when we transfer again, all said and done, in these patients, it is not, I would not treat them like a normal IVF case, but there are definitely special injections which we would put on them. Probably the progesterone supports would increase, and then, the blood thinner might increase. We might give them some extra benefits of something called intralipids, where it decreases the killer cells inside the uterus. So once we do all this, once we put them on complete support, then probably the pregnancy chances and the miscarriage rates would be lower, and the pregnancy chances having a healthy child would be more.
Right. The next question that we have is, me and my wife are both 28 years old. We have been married for 2.5 years and we have been having unprotected sex the whole time. She got pregnant last year, but it ended up with miscarriage. She again got pregnant 3 months back, but again got miscarriage. What should be our next stage?
You should meet a fertility consultant for this, because see, having a miscarriage once itself is one alarm. Having a second time is definitely a big alarm, and there is no chance that you can try at home. Yes, you might be getting pregnancy, but you might be losing pregnancy because of all the factors which I have already referred to for a recurrent pregnancy loss. So what once you come to us, we will definitely run you through all these problems or all these conditions, and we might most of the times, like almost 80 to 90% times, we might pick the problem and have a solution for it. It might be a simple polyp which is sitting there, which you would not know unless you do a ultrasound, wherein if you remove that simple polyp, the pregnancy will continue beautifully.
Right. So, next question that we have is, due to current lifestyle and career oriented mindset, almost every other person is under some sort of anxiety medications. How do such people balance their anxiety along with fertility treatment so that they don't get burdened out of the time that they have?
Yeah, I think meditation and yoga and calming down yourself is more important. Yeah, career is important, but it is not, it should not be your life-changing thing. It is to support your life. It is, why we all come for job or why we do things, being a HR, being a doctor, it might be a passion. Yeah, passion should be to an extent. There should be a limit for it. You can't impact your life because of your passion or because of your job. So I would definitely say it is just the mind balance. Probably they need some counseling, more session of counseling wherein they'll be on the right track.
Right. And the other question we have is, one fallopian tube is blocked and other tube is stuck. Please help with the line of treatment.
See, one tube is completely blocked. That's what they said, and the other is stuck. What I didn't understand the meaning of stuck. Even if some fallopian tubes are stuck, they might be open. It is that just that the fallopian tube is stuck to the pelvic side wall. So if it is open, you can still try getting her pregnant with simple treatments like IUI or a natural, ovulation induction whenever she gets an egg on that side. But if that stuck tube is also blocked, then we consider that bilateral tubes are blocked, and probably we give them options of either tubal cannulation if the other parameters are normal, like age, egg count, male factor is good, and all of them are good, then we opt them for a surgery wherein through laparoscopy we can try and open the tubes. In case if there is another added problem, let's say the egg count is less and the patient is above 40 and there is some male factor which grossly decreased count, in such cases we might opt for IVF.
Right. While you were talking about meditation and all, we have a question around, which is better, is gym or yoga better for PCOS?
um yeah, for PCOS, see, both of them are different gameplays. I would say I would not mix them both. Gym is definitely a proper cardio activity. It is, self strength training and things like that. And yoga is, the flexibility, the stretches which you do, the pranayamas which you do, both of them are equally helpful. I would not weigh one more than the other. I would always say you can do 3 days of gym and 2 days of yoga to, keep yourself right.
Right. And the other question we have is, do we require a cycle gap between one IUI cycle and another?
If all said and done, your age is good, your reserve is good, ovarian reserve, and the sperm reserve is good, and your tubes are good, I would definitely not give a break in between. There is something called cumulative IUI, the pregnancy chances. When we do IUIs on a regular basis, let's say without a break, the chance increases.
Right. Next question is, why do some women have difficulty in conceiving second time after having a baby through natural conception? And delivery and normal delivery, are there any precautions that they need to take to avoid such conditions?
Sometimes some things might not fall in your hands where you can control everything. In especially in these cases, as I said, it is like which is called a secondary infertility. She had her first baby, spontaneously, and she delivered naturally. That's a good thing. But when she comes to her second baby, she's having a problem. It might be because of the age, how much of gap they have given, and it might be because sometimes for the first baby you are thin, smart, and once you had a baby, your whole attention shifted to your baby, and you didn't give yourself some time wherein you've put on some weight. So there, the PCOS can still come in. PCOS can come in any time in life. It is not that we have to have it from the start. So it depends if it is in your gene, and then you put on even a little 2-3 kilos. Also, things might shift to PCOS, or it might be a tubal problem wherein the tubes have got blocked because of some reason after the first delivery. It might not be because of just the delivery, but probably some infection or something like that which has blocked her tube. Or it might be a male factor because of the age or because of the stress factor what he's undergoing. His sperm parameters would have also come down. These are general conditions wherein they struggle to have a second baby once all said and done they had a first baby through natural conception. But in depth, the rest of the things also have to be looked into, like fibroids, and those are, the second category.
Right. Another question that we have is, what is digital block?
What is?
Digital block.
I didn't get the question right.
Okay, so we'll move to the next question. My friend has regular periods, normal
Okay,
reports.
what is distal block? I think it is. It
Yeah,
is not digital.
it says digital block. I
Okay,
think it
probably
was.
it is distal block. I think she wanted to know about the tube. There is, let's say, there is a starting of the tube and there is an ending of the tube. If you take any tube for that matter, even your normal pipe which you're watering, the nostril which goes into your pipe is the proximal part. The nostril which the water flows is the distal part. So the mid segment is the mid part. That is how the tube is inside our body also. So the starting of the tube, which is attached to the uterus, is called proximal. When there is a block in that end, we say it is proximal block. When it's in the mid part, we say it is mid-segment block. When it's the end of the tube where the flow has to come out, that's a distal part of the block. So that's what they wanted to know. That's a distal block of the tube, where it is the end block of the tube.
Right. I hope we have answered your question. The next question that we have is, my friend has regular periods, normal reports for both husband and wife trying to conceive. Did multiple ovulation induction, follicular monitoring for the past 6 months, still not conceived. What should they do? Lifestyle changes for PCOS. Can you suggest few tips in gym or yoga? I mean, I think you have answered this question, but yes, about the follicular monitoring in past 6 months, they have been trying to conceive. What would you suggest?
If they have not done a tube test, probably they have to go ahead do a tube test, and they have to check whether the male factor is completely normal. And yeah, gym for PCOS is definitely recommended. I would say first option, if somebody asks me, it would be swimming. Would be my first exercise, because your whole body access comes into play in swimming, so it gets you back to normal much quicker than gym. So in gym, I would suggest proper strength training and cardio. At least cardio for 20 minutes and strength training you should do for almost 20 to 25 minutes. And in case if you can't do both of them, I would ask them to walk at least 10,000 steps per day. If they say no for all this, then I would ask them to do skipping at least at home, which they can do on their terrace or in their garden. So these are the things which I suggest. Not only this plays only like I should say 25% part. Rest 25% would be your diet. What you eat is really important. You're doing everything and then having junk food is not right. So what you eat, you have to monitor it.
Right. The next question is, I have irregular cycles, so I have used Dupiston
Mm.
from 16th to 26 days, but I stopped them. I used Metformin in good, or is it good or not?
See, what Dufeston does is it does, see, the whole cycle I will tell you. What happens is when a follicle is grown inside your ovary, this is how a normal woman gets her period. What I'm talking is, So once the follicle grows inside the ovary, then one day it gets released. When the follicle ruptures, there is an egg which is released. The egg releases two kind of hormones, which is called estradiol and progesterone. These are the hormones which make your layer of your uterus. The estradiol makes the layer, the progesterone makes it bleed or holds the pregnancy if there is a pregnancy. So these both hormones comes from the egg. In case of PCOS, what happens is there is no egg release. So these hormones doesn't come to change things in the uterus. So what this duphaston does is it's just an extra pill from outside. It is a progesterone pill which we give it from outside. So you will just get your period, but you'll never get pregnant if you're trying for pregnancy. That's not the right thing to do. The right thing in this case to make her pregnant would be to get her egg instead of just giving tablet to bleed.
Right. Doctor, we're getting overwhelming response from the audience with the questions, but due to paucity of time, we would not be able to answer all of them. For the last question, I would say that there is one question that we have got. I have had multiple failed IUI cycles. I then underwent IVF with good quality hatching embryos. My endometrial lining was also good, which was 11 to 12 mm. The sperm parameters were normal with no issues, and the ERA showed that my endometrium was receptive. My first IVF resulted in positive pregnancy test, but unfortunately, the pregnancy was not successful. I'm 27 years old and my AMH was 4.38. Given my history, what would you suggest as the next step of our procedure?
Yeah, whoever has done this IVF, whatever cycle, they have done it beautifully well. They've, covered everything. They got a good embryo. They checked their endometrium right, and they had a good endometrial lining. They did an ERA receptive test as well. That is the last step which we generally do for, making somebody pregnant. So they have done everything possible. Now the next step would be genetics. After doing everything and still you fail with a good quality embryo, then probably we have to dig more into the genetic part.
Right. And I think with that, we will have to close the session for today because we have already crossed the timings. For people who have posted their questions, please, we will definitely answer all of them to you. Or you can visit our doctor at Rainbow Fertility, Banjara Hills. And doctor, do you have any end messaging that you would want to suggest to all our audiences?
Yes. See, fertility is definitely a medical condition, like how you see thyroid or how you see diabetes. It is not a stigma which you have to have inside you. If I go to a fertility specialist, people will think me right or wrong. Leave about their judgment. What you want, you have to get it right. It's just a medical condition. So get treated and have a beautiful life instead of getting stressed by yourself. And we are here at Birthright Fertility by Rainbow Hospitals to help you not only to guide you through your parenthood, but also to give you a beautiful success rate. And so, why are we different from the others is definitely because we are trustworthy, we are very ethical, we are evidence based, and we have a teamwork. It is not a single person, and we are crystal clear. We give, we are very clear on things what we do. The transparency makes Rainbow apart from all other centers.
Right. Thank you so much, Doctor, for joining us today. And we hope today's discussion was helpful for many of you answering the questions and dispel the myths that you had. And it reminded you that you're not alone. Please seek help. It is important to speak to your doctor to understand what is the next process. On behalf of entire Rainbow team, we thank you. We thank each one of you for joining us today. And we hope that today we leave with you guys leave with a greater confidence and more clarity. Thank you once again. Thank you, everyone. Thank you, Doctor.
Thank you, Soumya.